So this course is called Measuring Health System Performance, and it's all about learning about the different indicators that we use to measure the performance of the health system, healthcare providers, and even individuals in a healthcare system. So in the course, we'll be covering the state of the art of performance measures across a range of performance areas that policymakers and providers are interested in. Things like quality indicators, indicators of safety, how do we measure efficiency of a healthcare system or a hospital, and then we'll be looking at different methodological aspects of those indicators. So for example, how do you combine multiple indicators together to get a summary measure of performance? Or how do you adjust for factors that you might not want to influence a performance measure? Things like the age of patients, which might likely influence their outcome. And then finally, we'll be looking at performance management programs that make use of these indicators. So how do we attach indicators to financial incentives or to public reporting? And what are the implications of doing so? What are the things that we need to consider? And what is the evidence about how well these programs work and what we can learn from past experiences? You can expect to walk away from this course with a good understanding of what are the key performance measures that policymakers, providers, managers use to assess the performance of different entities in the healthcare system. You'll walk away with a good appreciation of what are the challenges in implementing these performance measures, what are things that you need to adjust for, what are the considerations that you need to take into account when you're making decisions about what to measure, how to incentivize it, and how to use these different indicators. The most interesting or exciting aspect of the course is a real-world case study that comes in the second half of the course. We'll split students up into small groups and give them information on a real health system representing a real country. They'll have indicators that are used and measured by different international organizations representing different aspects of performance of that healthcare system. Things like, what is the quality of care in that health system? What is the coverage of care? How efficient is that healthcare system? And we'll ask students to answer a series of questions around these indicators. How well does the selection of indicators represent their own health system's priorities? Is the methodology for constructing these indicators sound? Should we add financial incentives or other incentives to incentivize improved performance around these indicators? And this will all culminate in a series of 2 workshops at the end of the course, where students will come together with the other groups and debate these issues in a workshop. This is really exciting because it really shows the real-world application of all of the material that we've been learning throughout the term. I think the real-world application of this course is easy to see because the course itself is so applied. During the course, we'll be working with real-world indicators, indicators that policymakers commonly use or healthcare managers use to evaluate their healthcare systems, or even healthcare providers are evaluated by. So walking away from this course and thinking about when you'll be using the material in the real world, it might be as a policymaker when you're deciding which indicators to use to evaluate a healthcare system. It might be when you come across a news article that says one healthcare system in particular is the best of all others. You'll be able to really critically appraise the methods used and make that decision for yourself. Similarly, when you look at indicators that evaluate provider performance, you'll be able to look at those and think, does this really measure the quality of care, or are other factors being captured? And how much do I really believe the assessment from these indicators?